Everything's going on. Okay. What would you rate your pain on a 0 to 10 scale? 0 being no pain and 10 being the worst pain that you've ever felt. Many of us have been asked this question by a doctor or nurse, and it is of high importance to remember that everybody's pain threshold is different. Numerous studies have been conducted on various aspects of the opioid epidemic happening in our country right now, and what is to be done about it. You may be wondering, how did the epidemic start in the first place? The thought was increased use of opioids first started with cancer-related pain. Professionals claimed that no addiction occurred. These claims were found to be false, and thus began the epidemic of the opioid prescribing in the 90s. Between 1999 and 2016, more than 6,300,000 people in the United States died of drug overdoses due to the opioids. The first wave of the opioid epidemic consists of overdose deaths related to opioid pain relievers. The second wave was due to heroin, and the third wave of deaths was due to fentanyl. In 2010, there was an expansion of the healthcare research and quality of the hospital consumer of healthcare providers and systems survey that rewarded hospitals that scored high in clinical processes, outcomes, and patient experiences. Patient experiences focused primarily on the patient's pain and how it was handled. Patients tended to score the hospital lower if they were denied pain medications. Now you may be asking, what is being done to solve this epidemic? Bernard discusses a couple of approaches that have been taken to solve the opioid epidemic in our country: prescription drug monitoring programs, mandatory educational programs for relicensure of healthcare providers, and the use of naloxone. What is naloxone, or other known as Narcan? It is an opioid antagonist, meaning that it binds to the opioid receptors that can reverse and block the effects of other opioids or somebody that is having an overdose. The North Carolina Opioid Action Plan was created to lay out 6 steps that will best reduce the burdens of death from the epidemic. The following are the strategies laid out in the action plan. Strategy 1, reducing the oversupply of prescription opioids. Strategy 2, increasing community awareness and prevention. 3, reducing the flow of illicit drugs in our state. 4, increasing access to naloxone and connecting overdose survivors to care. 5, increasing access to treatment and recovery. And 6, measuring our impact and revising strategies based on results. Project Lazarus launched in 2007 in Wilkes County, North Carolina, in response to the mortality rates due to the opioid overdose. This project teamed up with multiple community coalitions in every sector of the county and trained and educated them on designing the overdose prevention interventions. A few examples of Healthy People 2020 include private drug treatment centers. County sheriff and police departments are providing drop boxes for unused opioid medications. The Wilkes County Regional Hospital Emergency Department changed its policy from a 30-day supply to only 3 to 5 days supply of opioids. For primary care providers, created toolkits with best practices for treating pain, opioid risk assessment tools, patient-physician agreement forms, and educational materials. At public schools, Project Lazarus created programs that not only teach kids about the risks of drug use, but also help them build the decision-making coping skills to avoid it. As a future nurse, we have a high chance of encountering patients that are addicted to opioid pain medication, or maybe going through a withdrawal. It is our job to recognize this and come up with a plan for the patient. Some of the signs and symptoms that Felicia Reynaldo has researched states that the patient can become tolerant of some of the effects of long-term opioid use, including euphoria, respiratory depression, and nausea. Early signs of acute opioid intoxication include inappropriate behaviors such as initial rush of euphoria, followed by apathy, agitation, impaired judgment, and dysphoria. The 3 classic signs of an overdose are drowsiness, decreased level of consciousness, bradypnea, and pinpoint pupils. Other signs may include hypotension, bradycardia, cyanosis, and hypothermia. Naloxone is the main medication used to reverse the effects of an opioid overdose. The patient should be monitored closely and vitals taken frequently after the reversal agent is given. A patient going through withdrawal of opioid medications will display symptoms of diaphoresis, which is sweating, rhinorrhea, which is runny nose, pupil dilation, muscle cramps, joint pain, nausea, and vomiting, hypertension, which is high blood pressure, and bradycardia, which is slow heartbeat. Pharmacological treatment for withdrawal focuses on relief of the specific symptoms. The articles that were discussed today talk about the urgency of the opioid epidemic and talked about similar steps that they think that should be taken to help solve it. The most important aspect is realization that this is a problem and it needs to be taken care of. As nurses and citizens of society who want to help members of our society who struggle with addiction, should know the warning signs and what to do if a patient is addicted to opioids or if they have overdosed. Yeah.